welcome back to Nurse Talk. If you're a part of the nurse gang already, the Nurse Talking, welcome back. And if you're new to Nurse Talk, welcome. This is a channel where we talk about nursing related topics. We try to talk to new grad nurses and the OG nurses, and we try to dazzle a little travel stuff in there too. So if that's something you would be interested in, stay tuned.
So today we're talking about RaDonda Vaught. Yeah, she's kind of in a tough situation right now. She is on trial for
giving a lethal dose of vecuronium.
And they're calling it reckless homicide.
Right.
So, to give a little background, for those of you who don't know who RaDonda Vaught is, back in 2017, she happened to take out a medication for a patient.
The patient's name was Charlene Murphy. She was a 75-year-old female.
And she came in originally for a subdural hematoma, which is a brain bleed. So after that, after becoming more stable, they were going to do a scan. Right. For the scan, she needed something that would help her relax. And they gave her, they were supposed to give her Versed, but unfortunately, she ended up getting a medication called vecuronium.
Right. So she ends up getting this vecuronium, and she goes down for this radiology scan. And while she's in the scan, she's lying still, of course, which everyone wanted. But at the end of the scan, they noticed that she's not breathing. They ended up calling a code, a code in the hospitals where they get everybody in because the patient is now pulseless. So they start a code. They try to bring her back to life. They were able to bring her back, but too much damage had been done at that point. Within 24 hours, the next day, the patient ended up passing away. There's so many moving parts to this case because it originally starts off with a medication error, but then after looking at the details, so much more is going on, and it's just like.
Well, also what we didn't mention too was the fact that their pixar system was faulty that day. So when she took the medication out, she had to override the system.
Right.
And this is because their system was down at the time.
Right.
So you also have that factor. The factor that Vanderbilt didn't report this, because she reported herself after she made the med error. She actually admitted to the error like you're supposed to do. And she did everything that she was supposed to do after the med error. And Vanderbilt didn't feel the need to present that information with the reason for death, nor to the Joint Commission, nor to
the state.
Yeah. So I mean, like you were saying, it's a lot of moving parts to it. So it is kind of scary as being nurses. Is that what the result is if you do make an error? Because at the end of the day, people are still humans.
Right.
Yeah,
what are you guys thinking about this case? We're going to be following it as it goes along, and we'll see how this goes. We'll see what the jury says, how this ends for her. But let us know what you think. If you're a nurse, let us know about your personal experiences. If you can relate to something like this, have you heard of any other instances that happen like this? I'm sure that Vaught's not the first of her kind. So if you guys have any stories that relate or anything, let us know.
Yes, any of your thoughts, opinions, any of those things. We want to stay connected with you guys and kind of get a discussion going in the comments.
Right. So, again, subscribe if you guys were interested in the content that we provided today. And we will see you guys again.
Yes.
Thanks for tuning in.